Earlier in patient rights, I would have told that providing the medical records to the patients are their rights and you're supposed to give the medical records to the patients. It is also important for the hospitals to maintain these medical records in a safe place where it's not mishandled. Medical records can be used against a patient, it can be used for a patient, and it can be used against a hospital also. So it's a very crucial document. So what do you do when a patient or a patient relatives comes and asks you for a medical record over a phone call? So would you provide the medical record to them directly through some means, or you will wait and you will retrieve some information? Of course, you will ask certain questions before providing the medical records. Why? Because they have contacted you over phone call. So it can be anyone who wanted to use these medical records against the patients. Either in the code of law, they wanted to file a case. Let's say two people are married, so one person wants to file a case against the other person for some mental health issues. So medical records can be approved there. Or when a person has to get the claim of some land or property, but still providing the... So when a patient asks you for the medical record over a phone call, kindly ask them if they are the person and ask their medical records number or the hospital number. If possible, ask the patients to come in person. So if it's not possible for the patients to come in person, they are located elsewhere, really far, then ask them for their Aadhaar card number. So Aadhaar card number or some government's proof will, it's like a secure number. Not everybody will have an access to it. So they have their own Aadhaar card number. So ask for at least 2 or 3 government's proof through mail or something, their number, and then you can send the medical records through post, through some secured means, keeping it very confidential. Or you can ask the patients to come in person. So when they come in person, ask them to sign the register or something. Try to maintain a register where and which documents you have provided to the patients. So this will help you in the future days, that you have provided what documents to the patients who had come and they had signed it themselves. So this will protect the hospital and this will also protect the patients. So following the ICD, International Classification of Diseases, the latest edition has been 11, but most of the hospitals are using 10. So according to this classification, you're having the alphanumeric basis, the medical records number and the hospital number for the patients, and you're supposed to maintain this in the separate space as a medical records room. It'll be nice if you can make it paperless, but even if you make it paperless, it's good to have the hard copy of the medical records. And whenever you provide a medical record to a patient, try to have one copy for yourself, the original, and then you can provide the details of the prescription and basic details to the patient. When they ask for specification, and then you can provide it from the medical records that you have stored to the patients, either as a Xerox copy, and you can actually get the authorization, and you can get the signature from the patients for which purpose they are asking and what are the documents that they have retrieved. In general, the OP records are maintained for 3 years, and the inpatient records and the medical legal cases records are maintained for 10 years. The medical legal cases are a different genre itself, and I'll try to cover that in my upcoming videos. And when it comes for medical records, also labeling the hospital numbers properly on the records using the MR number or the hospital number. Only the hospital number on the top of the medical records is essential, so that you can retrieve it very easily. If possible, you can actually barcode all these medical records and you can actually put them in your database so that it can be retrieved easily in the upcoming days. Also, having your own understanding of the biohazard patient and labeling the biohazard patient on the top of your records, or if possible you are using some software to retrieve the medical records, there you can keep it like a pop-up for the biohazard patient. So biohazard patients you have to specify so that the clinician or a healthcare person, whoever are treating the patients, would be careful themselves. So this is an aspect of occupational safety. So in my next videos, I'll try to cover about medical legal cases, duties and responsibilities of doctor, and who are these biohazard patients, and how you're supposed to identify and treat the patients, and how the occupational safety of various healthcare workers can be maintained. Thank you.